Great, thank you so much, Brian, and thank you for joining us. So during today's presentation, I'd like to provide you with an update on the monkeypox numbers internationally, nationally, and here in Colorado, and then share with you what we are learning about this virus and how it is spread from person to person. So starting here, as of today, there are more than 3,000 cases that have occurred in 41 non-endemic countries. And when I say non-endemic countries, that means countries outside of Central or Western Africa, where monkeypox cases more commonly occur. There have been 142 cases in 23 states and Washington, D.C. And here in Colorado, we have reported 5 cases. Among our 5 cases, there have been no hospitalizations or deaths. And the same holds true for deaths nationally. There have been a small number of hospitalizations that have occurred nationally, but no deaths have occurred in the U.S. Important to note that the version of monkeypox that is spreading right now in the US and these non-endemic countries has a fatality rate of less than 1%. Next slide, please. So here is a map from CDC's website that just shows you the distribution of cases across the country right now. So you can see cases have occurred West Coast, Central US, and the East Coast as well. And this is current as of today. Next slide. So I want to shift gears and talk a little bit about how monkeypox is spread. But first I want to talk about how monkeypox is not spread. So brief interactions without physical contact are unlikely to result in transmission. And all of us have learned a lot about a very different virus in the last 2.5 years, and that's the SARS-CoV-2 virus, the virus that causes COVID-19. And so I think it's helpful to point out that these are 2 very different viruses. So the monkeypox virus is very distinct from the COVID-19 virus in that it's really not spread nearly as easily as COVID-19 is spread from person to person. Really, spread of the monkeypox virus depends on close contact. And if you go to the next slide, I'll get into the details. So monkeypox is really primarily spread through close contacts with individuals that have a monkeypox rash, sores, or scabs. It can also be spread through close contact that occurs during sex. The virus can be transmitted from the time an individual has their symptoms first begin until the time when all of the lesions on that person have healed and new skin has formed. The epidemiology and the data are showing us current increased risk among people who have traveled to a country where monkeypox has been reported and or men who have sex with other men. Next slide. And really, we're seeing quite a bit of variability when it comes to the symptoms of monkeypox. The rash, or even sometimes we just describe these skin lesions or skin bumps as blisters or pimples. And those skin bumps can appear on the face, inside the mouth, and on other parts of the body, like hands, feet, chest, genitals, or penis. And those skin bumps can be localized, meaning that they can be in just one area, just a small number of those skin bumps, or they can be more generalized or more widespread on an individual in multiple locations on their body. Sometimes people get a rash first, followed by other symptoms like fever or swelling of lymph nodes, but sometimes people only experience a rash. Next slide. And so I want to talk a little bit about the work that public health is doing. So when public health identifies a person who has tested positive for the virus, we ask that person to isolate at home and to stay away from people, pets, and to not go to work until all lesions heal and new skin has formed. And the goal there is really to prevent that next generation of cases, further spread of this virus from occurring. With that similar goal in mind, public health will ask that individual about potential exposures they may have had. So ask about travel, close contacts they've had, and then medical visits they've had. And the goal there is really to prevent that case from going on to causing infection in other cases. So this is, again, similar to what we've done over the last few years with COVID-19 and case investigation and contact tracing work. The interviews that we are conducting, the information is kept confidential. And our ask is really for individuals to please return calls from public health when we reach out to you if you have been identified as a monkeypox case. Individuals who are identified as contacts of a case are then monitored daily for symptoms for 21 days after their last contact with the case. And again, the goal there is to quickly identify individuals who may go on to become cases, develop symptoms, and also try and prevent them from developing infection through treatment. We'll talk about that next. Next slide, please. So overall, really many individuals are going to have a mild illness without treatment, and the virus is going to resolve on its own. But there are treatment options available. Most notably, the State Health Department has ordered the Jynneos vaccine, and we're using that vaccine as what we call post-exposure prophylaxis, meaning treatment of individuals after they have had an exposure to the virus. The vaccination is really focused on individuals who have risk, who've been exposed, and those risks are classified into these immediate or higher risk levels of exposures. So that's going to include healthcare workers and other people who have had direct contact with the person who's identified as a case. It's really through work with your physician that your physician or healthcare provider is going to help identify if post-exposure preventive treatment is right for you. And that treatment is going to primarily be through vaccination with that Jynneos vaccine. And the goal of vaccination is to either prevent your infection from occurring if you've been exposed to the virus and you're incubating infection potentially, or if you have been infected, to prevent that infection from being a severe infection. And really the goal is to have the vaccine delivered as quickly as possible. And this is really why the case investigation and contact tracing work we're doing and promptly responding to public health is important, because if we have the ability to provide an individual with that post-exposure prophylaxis vaccine within 4 days of treatment, there's a pretty good chance that person is not going to go on to develop infection after their exposure. The vaccine is still beneficial after that time frame, after 4 days after exposure, and potentially helpful all the way out to about 2 weeks after exposure. But probably more likely when you get further out from that timeline of exposure, that the vaccine is going to be more helpful at modulating or making the infection more mild than it would have been otherwise. And with that, I will turn it over to Director Bookman.
Thank you, Dr. Herlihy, and thank you all for joining us here today. Obviously, for the members of the media who have been joining us for our COVID updates for the last 2.5 years, you are used to Dr. Herlihy and I coming here and presenting you with information. I really do want to call out that this is a very different situation than the COVID-19 response that we have been talking about over the last 2 years. This virus is not nearly as transmissible. We are not seeing widespread transmission at this point. But we did want to come and give you all an update on this today, given the level of national and international media conversations that are happening around this. Also want to make sure that those who are at high risk have the information that we have so that they can do all that they can to keep themselves safe. Over the last 2.5 years, our health department, CDPHE, has obviously been organizing an enormous response to COVID. We are also coordinating our response to monkeypox at this point, but at a much smaller level. And so just to give an overview of what we're doing is our state lab is coordinating and performing orthopox testing. And then if we do have a positive orthopox result, they will send that test off to CDC for confirmation. Dr. Herlihy and her team of epidemiologists are really focusing on that case investigation and contact tracing, in addition to monitoring of close contacts for 21 days after exposure. We are ordering a small amount of vaccine. There is a limited supply in the country at this point. It is all controlled at the federal level, and working with our federal partners, we are able to order it. We do have some stored at the state lab for redistribution to healthcare providers who will need it. And so our teams are working in coordination with that, but there is no mass vaccination happening at this point. Obviously, we are concerned about our healthcare providers and making sure that they have all of the information that they need to protect themselves and to identify cases. And so we are providing infection control guidance. We're also sending out health alert network messages as needed to make sure that all of our healthcare providers in Colorado have the most up-to-date information and know how to reach out to our team here at CDPHE to help them with decision-making as we go forward. And then finally, really continuing our community outreach and engagement efforts to make sure that everyone is aware of this illness, what to look for, and the importance of contacting a healthcare provider if they do have any of the signs or symptoms. So I think with that, Brian, I'll turn it back over to you.
Thank you, Dr. Herlihy, and Director Bookman. We'll open it up to the Q&A portion of this morning's briefing. We'll use that raise hand function. You can find that located along the bottom of your Zoom console. We'll start with first questions first. If we have some time left, we'll go back for second questions or follow-ups. And please state your name and outlet before asking your question. Let's go ahead and get it started with Sarah Flower.
Hi, good morning. Thanks for taking our questions here today. This is Sarah Flower with KSUT Tribal Radio. My first question is, I know that there are 5 confirmed cases. Do we know how many are in the queue and waiting? And my second question is to Dr. Herlihy. In your 10 plus years with CDPHE, does something like a monkeypox outbreak at this juncture surprise you and your team?
Oh, great questions. So the 5 cases that I mentioned are confirmed and probable cases. With monkeypox, there's 2 steps involved in testing. The first test is performed at our state laboratory, and that identifies the orthopox family of viruses is present in a specimen. And then that specimen is sent on to CDC for confirmatory testing. So the total number of cases that you could say we have in the queue right now would be that 5. Not all of them are confirmed at this time, though. So some of them are awaiting confirmation at CDC. So whether I'm surprised at this situation, it certainly is an unusual situation, but I would say that COVID-19 has certainly taught me and our entire response team to be prepared for a variety of situations. I think it threw the COVID-19 response through multiple curveballs our way. And I'm honestly thankful for the infrastructure that we've been able to build over the last 2.5 years. I think that has aided us really well in being able to respond to this latest public health emergency.
All right, let's go to Meg Wingerter.
Hello, this is Meg from the Denver Post. I had a question. If you could clarify a little bit about what close contact means in this context, because we're mostly hearing about, in terms of sexual contact, but like, would you need to be direct enough, like kissing the person or close, or like if somebody has a platonic roommate that has it and, they're not in close physical contact, but they're sharing a space, could you define it a little more?
Sure. Yes, I think the close contact would fall into some different categories. So certainly close contact, that is considered skin on skin type contact. Kissing, you mentioned, sexual contact, that would certainly be one route of exposure. But we also know that there are other potential routes of exposure. We know that the virus can be spread through large respiratory droplets, but again, very different from COVID in that brief interactions with people are very unlikely to result in transmission. Instead, it's really going to be much more prolonged contact. Sharing a household, I think, as you mentioned, would be a great example of a place where individuals could be at greater risk, even if they were not necessarily having direct physical contact. Another, I think, less common route of transmission that has been noted is contact with contaminated linen. So if you had a roommate or a member of your family who was an infected case, you would want to be quite cautious in handling those linens, sheets, towels, those types of things.
All right, John Daly, go ahead.
Hi there. Thanks for taking our questions. Really appreciate it. I was wondering if you could tell me how many monkeypox tests are run by the state per day or per week, and does the state have enough of those tests to kind of get a good read on what's happening out there?
Yeah, at this point, it's really still a small number of tests that are being run. In fact, we're not running the test every single day. So I'd say a handful of tests are being done each week. We do have sufficient reagents. So at this point, CDC is providing states with the reagents and supplies that we need to do this testing. We have a supply that is adequate for several weeks at our current testing rate. If we get beyond that period, we would certainly request that CDC replenish our supplies so that we can continue testing.
All right, Seth Klayman, go ahead.
Thanks. excuse me, Seth from Gazette. Are all of the 5 Colorado cases, some of which are presumptive, are they all linked? I know there was one, the initial one I think was from travel. Are the other 4 linked to that one? Thanks.
No, all of our cases are not linked at this point. So we have those 5 cases, but we can share that of those 5 cases, they are among individuals that have traveled internationally or individuals that self-identify as men with sex with men.
All right, let's go to Rob Dawson.
Can you hear me?
Yep.
Okay, good. I just hit the button. You know, you were talking about fatality rate being low, less than 1%. This is a different kind of virus than COVID, but is it still important from a contact tracing standpoint for you?
Absolutely, and that is why we're really asking for individuals that have had exposures or have symptoms to present to their healthcare provider and seek testing. And then, of course, to also work with public health if you've had an exposure or you test positive so that we're able to do that contact tracing work and really limit the spread at this time.
All right, John Ingold, go ahead.
Hi, yeah, John Ingold from The Sun. Thanks for taking our questions. So if I'm understanding right, it sounds like all the cases are related to travel or in specific higher risk communities. Do we have local transmission that's been confirmed here? No community transmission, it sounds like. And then do you know when the most recent case was and how many doses of vaccine have been administered to either healthcare workers or close contacts?
I'm going to need help remembering all of those questions. Okay, so your first question, so sorry, can you repeat the first question? So you had said international.
Any local transmission or community transmission?
Yeah, so at this point, we have not identified a case that has not traveled internationally or been linked to another case within Colorado. I would say, though, that that doesn't mean that hasn't occurred, but we have not identified evidence of local transmission that has gone undetected in Colorado at this point. So I think that would obviously be a change if we were to detect that. And I know that has occurred in other states. So New York or other states, there are cases that have been identified that were not linked to other known cases or had not traveled. But at this point, that is not the experience here in Colorado. And then your next question.
When the most recent case was identified?
Yeah, I am sorry, I don't have that date on me. I don't believe it's been within the last few days. I would have to get back to you with that date of the last case.
Okay, and then doses of vaccine?
Yes, 24 doses of vaccine have been given to individuals for post-exposure prophylaxis.
All right, let's go back to Mike Wingerter.
Hi. Is there anything that you're recommending people do at this point to try to reduce their odds of coming into contact with the virus? Is it just, if somebody has an unusual, try not to have close contact with that person, or what should people do? Thank you.
Yeah, really our primary goal right now is to prevent further spread. And so we want people to be informed of what the signs and symptoms of monkeypox are. And if individuals believe they have any of the signs and symptoms of the virus, to see a healthcare provider and determine if testing might be needed. And then similarly, if individuals believe they may have been exposed, to again see a healthcare provider and determine if preventive treatment might be needed in those individuals.
All right, Seth.
Thanks, Seth again. I don't know if this is best for you, Dr. Hurley, or for Scott. Can you talk a bit more about the information and guidance you're sending to healthcare workers or directing their way on this issue?
Yes, I can take that. So we are using our Health Alert Network, our HAN system, to provide information to healthcare workers across the country, across the state. We've also provided a series of webinars for healthcare providers to share information. And again, I think the goal there is early recognition of cases and ensuring that any cases that may potentially be occurring in Colorado are identified.
All right, do we have any other first questions? Otherwise, we might have time for a couple more follow-ups here. All right, let's go to John Daly.
So yeah, just following up, what do you see as kind of the most worrisome scenario here? Both sort of in Colorado, but also, beyond Colorado. What are you worried about with this this particular virus?
Yeah, so I would say nationally and here in Colorado, I mean, even internationally, there's ongoing discussions about, are we at a point where containment is going to be challenging, meaning that are we still in a place where we could suppress transmission enough and prevent this virus from becoming endemic and something that's just regularly spread from person to person in countries outside of those historically endemic countries in West Africa and Central Africa, where there's animals that we believe are the reservoir species. So I think that's really, something that we're trying to determine at this point, but I think really only time is going to tell. I think there's also lots of questions around the future role of vaccination in preventing cases. Our strategy thus far has really been post-exposure prophylaxis, but I know in other countries there have been ongoing discussions and efforts to do more pre-exposure vaccination. So vaccination before individuals are potentially exposed. And so that might be a future shift. And so certainly looking to our federal partners for guidance on future strategy for trying to control transmission.
All right, and we'll go ahead and go back to Meg here.
Last question from me. You said about that the state has ordered a small amount of the Jynneos vaccine. Can you say how much you're expecting to get? Thank you.
So, Meg, I think it's important to know that the CDC and HHS really have the stockpile of this vaccine. We have ordered somewhere around 100 doses. And more is available. But at this point, the national supply is relatively small, and so it is being controlled at the federal level.
All right, and with that, we will wrap up today's briefing. Thank you, Dr. Herlihy and Director Bookman. You can always reach out to us if there are any questions that you have later in the day or that we were not able to cover here on this morning's briefing, either at the State Department email there in the presentation, or you can email me directly at brian.spencer@state.co.us. Thanks again for joining, and let us know if you have any questions. Have a good one.